Hey everybody, Randy Kurtz here for the ISB. So this month I would like to talk about the rotator cuff. The rotator cuff is a group of muscles in the shoulder, the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. And rotator cuff is a common injury for upright bass players in that you're going to be playing in this way a lot for a lot of years, and this puts pressure and strain on these muscles that are the support and the strength for the shoulder. And so you can see how a rotator cuff problem would come into play. I'm inspired by a phone call I got earlier today by somebody with a rotator cuff tear. Now, rotator cuff also is one of those things that is used to describe a lot of problems that it may not actually be. For example, people talk about almost any problem in the wrist as carpal tunnel, many times frequently incorrectly, as we've talked about here in the past before. The same thing with disc problems in the back, the disc going between the vertebrae, the bones, and the spine. And people will often say, oh, I got a disc problem, or I blew out a disc, because it's a popular term, and it is usually, or at least frequently, not the case. Same with the shoulder. Many times somebody say, oh, yeah, that's a rotator cuff, because they have had a problem or know somebody who had a problem, or they read an article or something of that nature. Again, unless it is one of those four muscles, the supraspinatus, meaning the above the spine of the scapula or the shoulder blade, the infraspinatus, or below the spine of the scapula or shoulder blade, the teres minor, which you have to access within the armpit here, and the subscapularis muscle. All these muscles, the rotator cuff proper. Many times when one has an issue, again, in our profession, it will be a rotator cuff proper. That can be diagnosed by doing various orthopedic tests, seeing how you can lift your arm or lack thereof, strength, etc., etc. Many times an MRI, while it will certainly diagnose a rotator cuff tear, is not used because if the tear is small enough, there's not going to be anything done about it anyway. There will not be surgery. There will not be an issue. This doesn't mean one shouldn't get an MRI or shouldn't have it properly diagnosed. It really depends on the practitioner, but you will not know for sure via MRI many times because the practitioner won't feel it's necessary. There are different treatments for this kind of thing. There are physical therapy things, which can include modalities such as ultrasound and electric stim to help to relax muscles, strengthen the area, promote blood flow to the area, which is not so great for tendinitis because it causes more inflammation, but good for tears because it can help to heal those smaller tears. There's also strengthening and things of this nature, which, while sometimes good, must be used judiciously, meaning I always encourage one to bring their instrument to their doctor or therapist's office. Even though it's a hassle lugging that big instrument around, they don't know what you do, and you need to show them exactly what it is that you do so they know, so that if they give you a procedure for strengthening, for example, or something that they give to everybody else that has a shoulder problem, it may not be appropriate for you and may cause your problems to at best not get better or at worst worsen. So again, bring your instrument. One size does not fit all. Everybody reacts differently to different treatment methods, so it needs to, again, they need to have a handle on what you're doing and not just give you the same old stuff. I am going to go over all this in detail at the ISB convention. I'm speaking 9 o'clock on Thursday, June 8th, I believe it is. You can check the schedule. But I'm going over the anatomy of the basis, which means I am going to go over particular muscles that are used in the playing of the instrument and show them and describe what they do and why they may have problems and what to do about about them. So if you're at the ISB convention, which I hope you are, please stop by and see the lecture and come see me, and I'll take questions, and I will be around for at least a couple of days during the week also to answer any questions anybody might have. Feel free to grab me. So that's it. Randy Kurtz signing off, always available at www.drkertz.com, where my book, The Basic Guide to Injury Management, Prevention, and Better Health, is available as a physical and an ebook. Running low on the physical books, so if you're interested in those, I'll have some at the ISB convention, but again, now's the time to get them. The ebooks seem to be very popular. Also available for Skype, and I hope to see you at the ISB convention. If you have any comments, please keep them coming. All the best. See you later.